Hi, Rod Rohrich. Welcome back to Rohrich Knows Podcast. Skincare. Everybody talks about it. Everybody thinks they're an expert, but very few people are. And also, when you talk about skincare, what are the important things that you really should do? So I've got my great friend here, Dr. Missy Clifton from Bentonville, Arkansas. She's going to set the record straight on how to get the best skincare and to get the best results for you. So Missy, how are you doing today? They want everybody wants to have look like you and your skin. So what do you tell your patients so that they're compliant and they actually use the products that you tell them?
I think it's very difficult because the world is an overwhelming place now.
Right.
Even when you go to Walmart or Sephora, there's thousands and thousands of products. And then you come home and on Instagram, someone's recommending something. And on TikTok, somebody's doing something. And maybe your girlfriend, has something that she really loves. And so you maybe have accumulated a lot of products that you don't know what in the heck you're doing or when to use them or how to use them.
And you don't use
any of them.
Yeah, and you don't use them, right? So.
Yeah, they all just get shoved under the counter because you're like, I have no idea. I spent hundreds of dollars, but I have no idea. So when patients come into me, they come in very confused with usually bags of products. And we like to clean your face. You need to take all your makeup off so I can see what's going on. A lot of times we'll do a skin analysis with Visia to kind of see, really what's happening. Do we have hyperpigmentation? Do we have deep sun damage? Are our pores clogged? Do we have a lot of P. acnes or more acne-prone skin? Is our skin hydrated or dehydrated? So we try to really get baseline knowledge. Of course, we talk to the patient, see what their main concerns are. But then ultimately, we have to create a regimen that people are going to like to use, want to use, and actually use. Okay?
Great.
Because it's not like osmosis. You can't just set it on your counter and then it just does what it's supposed to do. You really have to be able to use it.
Right.
So I love for people to get a really good cleanser, depending on their skin type. It might be just a really mild cleanser that gets rid of a lot of the makeup or the oils and everything that we accumulate during the day. Or it might be an exfoliating type cleanser, depending on your skin type. So everybody needs a really nice cleanser that they can use, that they'll really, really like to use. Every single human needs a sunscreen. And it needs to be something that they will literally put on every day. And I tell them, put your sunscreen by your toothpaste, because I'm pretty sure you're brushing your teeth every day. So if you're saying, I just can't remember to use my sunscreen, I'll say, well, probably could if you actually made it a priority, like brushing your teeth. So I tell people to put it right by their toothpaste so they don't forget to use their sunscreen.
Smart.
And there are a plethora of sunscreens out there. There's powders, there's really light, watery ones. There's moisturizing ones. There's ones with antioxidants. We really try hard to find one that the patient is going to love, that's going to look great on their skin, and that they're going to feel very happy about putting on every day. So those are two keys. And then finally, you need to do something to help reverse the damage that has already accumulated, because we start to lose collagen in our 20s. We've all done our share of things that are not great for our skin, like being out in the sun too much. None of us have been perfect in that regard. So regardless of, what your skin issues are, you need to do something that's going to kind of help to prevent future damage as well as to reverse some damage. Sometimes that's something as simple as an antioxidant serum, that people are going to want to put on, every day, or even at night at bedtime as well. A lot of times that's a retinoid, vitamin A containing compound that is going to help to rebuild collagen, to kind of unclog the pores, to gently exfoliate over time, and to rejuvenate the skin as well. So depending on the patient's skin type, we will recommend something like that. And really, I try to keep it, Rod, before the podcast, you and I were talking, it's really good if you can keep it to, around 3 or 4 products for people. Right. Because it's so overwhelming. I mean, even for us, we're busy people. You want to get up, you want to do your thing, and you want to get going. Right. And at night, you're exhausted, and you don't want to do 25 steps. So I love those things that are just standard. You're doing 2, 3, 4 products during the week. I love products that you can use like maybe once a week, like a really good mask or a really good exfoliating, wipe that maybe you leave on overnight to kind of, get rid of some of the, just extra dead skin cells and kind of just give you a really a nice boost.
Yeah.
But so that I love the things that you're doing regularly that are a good, easy regimen, and then little add-ons that you can do here and there to really give your skin a boost.
Yeah. So do you do these morning and night, the cleanser, the sunscreen, the retinol, and the antioxidant? You do those morning and night? No.
So in the morning, definitely the cleanser.
Yep.
Definitely the antioxidant. And then definitely the sunscreen.
Yeah, but not the retinol because you don't want to deactivate it. Yep.
Correct.
Yep.
Absolutely. So at night, the cleanser, probably the antioxidant with the retinoid. Sometimes they're combined, or the retinoid with then an antioxidant or a reparative kind of hydrating cream on top of it. But you don't want to do anything that contains retinol, vitamin A, retinoids during the day because the sunlight can inactivate it.
Right. So are you a red light fan? Do you use red light at night?
I do. I'm actually a fairly big red light fan.
I am too.
I have a full body red light unit.
Oh, you do?
And I also have a Theraderm cap that I use for hair. So yes, I do red light every morning. After I work out, I usually work out, cold plunge, shower, red light, get ready. That's kind of my regimen.
Oh my God. Wow, it's not just skincare, it's everything else. Wow,
I'm trying to fight this whole aging thing.
Really
trying.
I think you're a winner. You look amazing. God, all those things. I mean, I use red light actually for my back, and then I'm just using it a little bit for the face. But yeah, I mean, it's got some good science. In fact, we're going to talk a little bit more about that in an upcoming podcast. So, all right, wow, that was fantastic. So, know before you go, simplified skincare, science-based skincare, and get somebody like Dr. Clifton to tell you about it and to stick to it. Don't just buy that bag that your friend recommended, and don't do it until you've actually got an analysis of your face and skin. Those are wise words. So thanks so much, Missy, for an amazing podcast. I know we've done a series today, but you're truly a rock star. So, all right, know before you go, give us your thoughts and comments, and until next time, wear sunscreen.